Okay, welcome everybody to our presentation on mental health and addiction system navigation, caring for your mental health beyond the physical. Okay, so let's get right into it. So, mental health and addiction services. This is a service offered to people in the Eastern region who may be experiencing a challenging time in their lives. We support individuals who are living with mental health and or addictions issues and their families, and there are various programs and services provided. There are a range of services, including assessments, individual, group, couples, and family counseling, consultation, education and skill development, referral to other services, aftercare, and follow-up. Therapy assisted online. Various programs and services are going to be highlighted and discussed today. And services are provided in person as well as many services being offered by phone and through virtual care, video conferencing from home and at various healthcare sites like for telehealth. So let's start with mental health promotion and addictions prevention. This team offers the following mental health prevention and promotion services and information to individuals, families, communities, organizations, and professional groups. They do Awareness Week activity support, awareness workshops and presentations, informal displays and interactive resources, prevention training, research and project consultation, resource development and access to resources, skill development workshops and presentations, and toolkits. So, some of the big focus areas for the mental health promotion and addictions prevention team are building community capacity, identifying resources, people with lived experience, school health promotion, ADHD, mental health in the workplace, life promotion and suicide prevention, stigma, general awareness, and mental health literacy, substance use and corrections and justice, alcohol action plan, overdose prevention, e-mental health services, and knowledge exchange. Some of the workshops and trainings provided by the prevention and promotion team are assist trainings, addiction prevention trainings, naloxone training, men's mental health first aid trainings, mindfulness, safe talk, self-care, trauma-informed care, compassion fatigue and burnout, and youth mental health and addictions. Now let's move right into mental health and addiction services stepped care. So, as each person's journey of wellness and recovery is unique, there is no right or wrong path. So, stepped care aims to match people with the right care at the right time, and then step up or step down in the intensity of supports offered based on their need, preferences, and readiness to engage in services. Person-centered in its approach, stepped care focuses on the strengths of people and communities and provides a range of options that recognize that one approach will not necessarily work for everyone. People most successfully use mental health and addictions resources and supports when they're ready, involved in discussions on progress with providers and decisions about their care, and when treatments are adjusted as needed. Okay. So now here we have the stepped care wheel. So partners in care, that inner circle surrounding the individual represents the many partners in care. That is both the informal and formal supports who help people in meeting their wellness goals. Partners can include, but are not limited to, family, friends, peers, healthcare providers, including family physicians and nurses, elders, community leaders, and the provincial mental health and addiction system navigator. Partners in care are a crucial component of a person's recovery journey and are involved throughout all steps of care. When healthcare providers and other partners in care work together across the system, a person-centered approach to support people on their recovery journey is happening. Working together, partners in care help people build upon the important relationships that have already been established in the person's life. This makes their recovery and treatment unique to suit their needs and personal preferences. The categories represented within the Newfoundland and Labrador stepped care model are meant to show a natural flow from the least intensive programs and supports to the most intensive supports and specialized programming. So let's start with wellness-based self-help in orange. People are empowered to self-manage their own health and wellness by exploring available resources and programs that focus on healthy eating, sports and recreation, healthy sleep, hygiene, mindfulness, social connections, and self-help options, as well as using natural informal supports like friends, family, or faith-based groups, for example. Peer-led and community support people. So peer-led and community supported, that's in the yellow. People can connect with peer-led and community support programs and services such as the Provincial LifeWise Warm Line and U-Turn Drop-In Center. These supports can range in intensity and involvement and be used throughout one's wellness journey. Next in our green, we have coach or counselor assisted services. In this step, people are supported with interventions through a blended approach of self-directed work using psychoeducational material paired with brief connections with a trained coach or counselor, either in person, online, or by phone. Coaches and counselors work with you on applying these skills to improve mental health and wellness. They provide support, increase motivation, and encourage connections to other services as needed. Next is individual, family, couples, and group therapy. Mental health and addictions professionals provide group, individual, family, and couples counseling to people with mental health or substance use concerns, as well as their family and friends, on a variety of topics. Counseling can be received in a variety of ways, such as in person, by phone, or video. Also, counselors work together with people to connect them with each other. Also, counselors work together with people to connect them with other steps within the stepped care model as appropriate. Doorways walk-in counseling service is also available throughout the province, including some correctional centers and schools, and provides fast access to mental health and addictions counseling services, one session at a time. People can attend Doorways as many times as they like, with the option to see the same counselor. Specialized services. Specialized services include intensive interventions to support people with multiple and sometimes complex needs, such as long-term mental illnesses or co-occurring disorders like a mental health diagnosis and a substance use problem happening at the same time, perhaps such as autism diagnosis and a substance use problem. Some specialized programs like the Opioid Dependence Treatment or ODT hubs and Flexible Assertive Community Treatment or FACT teams, they accept self-referrals. Others, like the psychiatry services, require a physician or a nurse practitioner's referral. When the need for specialized services is clinically proven, mental health and addictions professionals will complete a further assessment along with the person to identify services to best meet their needs. Inpatient programming, in our purple there. Some folks need a period of time using residential or live-in treatment at one of the provincial treatment centers, including the Grace Center, Recovery Center, Humberwood Addictions Treatment Center, Tuckamore Youth Treatment Center, or Hope Valley Youth Treatment Center. They work with their main healthcare provider, usually their doctor, and mental health and addictions professionals to determine their readiness for inpatient treatment. Assessing or getting into this level of service means people need to complete a specialized assessment with mental health and addiction staff, and there are unique conditions for getting accepted into each facility. Inpatient mental health care is also available throughout the province in acute care facilities, like hospitals and emergency rooms, and requires a doctor or nurse practitioner assessment for admission. Finally, emergency and crisis response in red. You do not need referrals or assessments to access emergency or crisis response services throughout the province. People can immediately connect with services by calling 911, 811, Kids Help Phone, Sexual Assault Crisis Line, and the Crisis Text Line, Text TALK, to 686868. In-person emergency services are also available by visiting any emergency department throughout the province. Mobile crisis response teams, made up of mental health and addictions professionals and trained police officers who respond together to crises in the community, are also available 7 days a week in each area of the province. So, how do I get in? Let's look at our access points. Here are our 3 access points. Navigating the variety of health services available in Newfoundland and Labrador can be challenging without clear points of access. Our stepped care model gives us three key access points to receive timely, quality mental health and addictions care. These three options are meant to be easily remembered and used, while giving us choice on how we wish to receive care. They include in person by visiting or calling your local Doorways counseling clinics, online by visiting bridgethegap.ca, and phone by calling 811. Together, these access points point people in the right direction to support their wellness journey. In person, Doorways provides rapid access to mental health and addictions counseling services throughout the province, one session at a time. Most locations offer walk-in services or can arrange same day, next day, or a scheduled appointment by phone or video. Individuals can return to Doorways as often as needed, and when additional services or supports are required, mental health and addictions professionals work with the individual to connect them to a service that best meets their needs. People who choose Doorways as an access point are asked to complete a Doorways screening form. The mental health professional uses that information gathered from the screening form along with their clinical judgment and information shared by the individual to work together in determining which services within the step care model would best fit their needs and readiness to complete programming. When lower intensity services, including wellness based self help, peer led community support, or coach or counselor assisted services, might be indicated, Doorway staff offer information, assist with registration for online programs, and/or complete referrals if necessary. When higher intensity services, including group, individual, couples, or family therapy, specialized services, and inpatient programming are clinically shown, Doorway staff assist individuals with navigation and referral to other more appropriate services. A complete listing of Doorway's locations is available by calling 811 or visiting bridgethegap.ca. Online services on bridgethegap.ca. Staffed by experienced, local, registered nurses, the Provincial 811 Healthline provides information about physical and mental health services. It answers health-related questions, triages, and refers people to more appropriate services when required. When people use the provincial mental health and addiction system by calling 811, a registered nurse will discuss their needs and concerns and directly connect them to a range of services as appropriate using a triage screening tool. When lower intensity services, including wellness based self help, peer led community supported, or coach counselor assisted services, are clinically indicated, the 811 nurse will offer information and/or provide live transfer to LifeWise to assist with registration and referral. If required, for online programs and services, oh, sorry, let me restate that. That was a little long. When higher intensity services, including group, individual, couples, or family therapy, specialized services, and inpatient program are clinically shown, the 811 nurse will transfer the triage information to appropriate regional health authority staff who will contact the individual to complete further assessment and determine appropriate services within the step care model. Okay, so those are our three access points. All right, let's look at our emergency services. So we have the PAU, or the Psychiatric Assessment Unit. We have the Short Stay Unit. We have emergency room consultation with psychiatry. We have a crisis line, the 811 crisis line, and the mobile crisis team. And we also have our crisis text line, Talk to 686868. So, for Doorways, as we stated, it's single session therapy or brief therapy. It's drop in, there is no appointment needed. However, you can call and you can make an appointment and can be scheduled in for that if required. This is staffed by addictions counselors and mental health clinical social workers and sometimes psychologists. Doorways is slightly different in each area, and they do use a stepped care model. And you can go to Bridge the Gap for a list of your local Doorways. And other mental health and addiction services. So we have wellness-based self-help. We have peer-led and community-supported, coach or counselor-assisted services, wellness group services, individual, family, couples, and group therapy, specialized services, inpatient programming, and NL groups. So let's first look at NL Groups, our provincial group service. So we offer with provincial NL Groups a 10-week depression treatment group, mental health skills and recovery group, 10-week anxiety treatment group, mental health drop-in group on Tuesdays, 5 to 6:30, an 8-week mindfulness and chronic pain group, a sexual empowerment group, Wellness Wednesdays or education groups for mental health and addictions on various topics. And currently being developed is a suicide loss group for grief and bereavement, as well as perinatal mental health. Referrals can be sent off to nlgroups at nlhealthservices.ca, and individuals can self-refer to any of these groups, or they can refer through a general practitioner, counselor, Bridge the Gap, or other contact. So let's look at our mental health and addiction specialized services. So FACT case management services are used for individuals 18 years and over with a mental illness that is having a more severe impact. The functions of the FACT team includes direct service provision, coordination and support, monitoring, and advocacy. We have the SANE program, or Sexual Assault Nurse Examiner program. The SANE program is staffed with a team of nurses who have an advanced training and education in medical and forensic assessment of a person who has been sexually assaulted. These nurses are committed to providing compassionate, sensitive, patient-centered quality care, as well as assisting patients in making informed decisions about their care and how to move forward. We also have our Sexual Assault Crisis and Prevention Center, which provides direct service to people affected by sexual abuse and promotes community awareness and sensitivity to the issue of sexual abuse. It provides consultation, in-person support, accompaniments to the SANE program, legal support and training, community development, and mental health promotion. We also have our mobile crisis response team. This team includes nurses, social workers, and police officers. They respond to people in crisis 7 days a week, providing crisis intervention in a person's home. The Grace Center in Harbor Grace. This is a provincial inpatient addictions treatment facility, a 21-day intensive treatment for adults dependent on alcohol, illicit drugs, prescription drugs, over-the-counter medications, and/or have gambling addictions. The HOPE program. This is a provincial intensive outpatient program where clients 15 years of age and older who meet the criteria as described in the DSM-5 for anorexia nervosa, bulimia nervosa, or other specified feeding and eating disorders, including binge eating, night eating related disorders, or avoidant restrictive food intake disorder. Also offers family support group with teleconferencing for those outside of the St. John's area. And as you can see, there are a number of other programs here. We have our sexology program, we have outreach services, mental health court and addictions court. There is also the peer program, psychosis intervention, early recovery, and a day treatment program as well. So there's a number of specialized programs offered by NL Health Services. Let's look at addiction specialized services. So we have the Recovery Center. A client must call or self-refer for the Recovery Center. Addiction services, individual and group counseling. We have the Opioid Treatment Clinic, where a client can self-refer by calling. We have concurrent addictions and specialized treatment, or the CAST program, in the St. John's area. This is connected, you can get connected to the service through psychiatry or access through adult central intake. The Grace Center and Humberwood. These are both residential addictions treatment centers, and referral must be made by a professional. Also, the SWAP program, which is the Safe Works Access program. We have U-Turn Drop-In Center in Carbonear, and the provincial addictions groups virtually. Child and youth mental health and addiction services. So child and adolescent central intake. Families and youth can call the central intake line directly for information, self-referral, and assessment. Referrals are screened and assessed over the telephone or in person by an intake coordinator and then assigned to the most appropriate service. Programs covered by Child Central Intake include the Janeway Family Center, Bridges to Hope, Janeway Psychiatry, community mental health counseling, and adolescent addictions. Bridges is ages 13 to 18, and they focus on short-term individual psychotherapy, family therapy, skill building, groups, and psychiatric consultation. The Janeway Family Center, children up to 18, individual and family therapy, specialized groups, separation and divorce anxiety, family violence, and parenting groups. Youth outreach, ages 10 to 17, brief intervention, act as supports, mentors, and assist with access to services. They have partnerships with schools and community agencies. And our Connect program, ages 12 to 18, youth who are experiencing complex mental health issues, and provides intensive support and resource coordination and assists with transition to adult services. Janeway Psychiatry has acute care psychiatry unit with 8 beds. The Tuckamore Center in St. John's at the Eastern Zone provides specialized treatment for youth from throughout Newfoundland and Labrador who may be facing complex mental health issues. The center is a safe, structured environment to address each young person's individual needs. It provides a therapeutic, home-like environment, as well as a school area, a multi-purpose room, a physical fitness area, and dedicated space for family visiting overnight. The Hope Valley Center in Grand Falls, youth 12 and 18 years. The center is a provincial service offering withdrawal management and stabilization services and residential addictions treatment specifically for youth. The average length of stay will be 3 months. However, youth may stay for longer periods of time depending on their needs. The center provides educational and recreational facilities, treatment spaces, and offices for clinical and administrative staff. There is generous availability of indoor and outdoor space for leisure and recreational activities. As well, we have doorways and select schools across the province. Here are a number of our e-mental health resources, from Bridge the Gap to TAO or our therapy assisted online, wellcentral.ca, Brain Story, 811. There's so many of them, and I highly encourage anyone who might be interested in e-mental health resources to check bridgethegap.ca as there is a wealth of information there. And here we have some important contacts. We have our mental health crisis line, 811, the kids helpline, the crisis text line. You can text TALK to 686868. The Newfoundland and Labrador Health Line, 811. Adolescent Central Intake, LifeWise Warm Line for peer support, Newfoundland and Labrador Sexual Assault Crises Line, bridgethegap.ca, and our systems navigators. We also have intake for adults. Thank you, folks, for being here with me today and taking in this presentation on mental health and addictions system navigation. If you have any questions, you can certainly forward them to myself at bailey.reed@nlhealthservices.ca, or you can certainly forward them to our mental health and addiction system navigator, Mr. Barry Hewitt. Thank you so much.